Kylee, great to see you back again.
You too. I'm glad to be here.
Thank you. Thanks for making the time. I think we had such an interesting chat last time.
Yeah, it really was.
I'm really curious to hear how your life has been since.
Ooh, a lot has happened. Still in therapy. I changed therapists. My old therapist retired, so had to find a new one. But my new one's pretty good, and a lot's been going on in life. I'm moving across the country very soon to Arizona, and what with all the current political events going on, it's just a very tumultuous time period. But I'm doing pretty well, all things considered.
I'm curious about changing therapy, your therapist retiring. That's a really big thing for someone who has a history of personality disorders because attachment is such a crucial part in terms of your recovery. What was that like for you?
For me, honestly, it was more of just like, okay, that was a chapter in my life, and now moving on to a new one, trying to find a new psych. I gelled really well with the new psych. The only thing that I did find interesting was that I've been already diagnosed by 3 different people with NPD. So the first psych who diagnosed me, and then I got a few other opinions. And I met my new psych, and he basically had the old knowledge of, well, if you wonder if you're a narcissist, that means you're not one. And a narcissist ego could never actually fathom they're a narcissist. So we had a little bit of a not disagreement, but I just didn't really like that sort of rhetoric that he was going around. But he consulted with my old psych, and then he came to the agreement that I do have MPD. So, yeah.
Wow, that must have been a really difficult experience for you, someone disputing your own knowledge of yourself.
It definitely threw me into a little bit of an identity crisis because it was like, okay, I've been making narcissistic personality disorder content for over a year. This is what I thought I was healing from, and now this person is telling me I don't have it. But also, he was trying to tell me I had histrionic personality disorder, which is what they used to kind of classify as any like female who has like MPD symptoms. They usually would throw HPD or BPD at them, and then if like any male showed it, they wouldn't really diagnose them with HPD or BPD. It would be MPD. So it was just kind of the old rhetoric being shoved at me.
Yeah. So I find it quite disrespectful and lacking empathy because in that situation, I think the best thing a therapist can do for you is to build rapport with you and, and explore how they can best help you. And the diagnosis of a personality disorder can be helpful or it can be really harmful.
Yeah.
So it's such a delicate thing that to say to someone either they definitely do or they definitely don't is it's perhaps maybe not putting the relationship at the forefront of what you're trying to do together and collaborating with you.
At first, I was a little defensive about it. I didn't make it really known to him because I don't like to hurt people's feelings, but I did end up talking to him, like kindly bringing up, being like, well, I already was pre-established, like diagnosed, and we talked about it. And he kind of changed his own viewpoint because after a while, he was like, I have treated MPD clients before, and you do have a lot of self-awareness, but I can also see why you meet the criteria. So it was kind of like a learning moment for both of us.
Yeah, and I guess like everything, there's a spectrum. And
yeah.
It's so hard to, some people want to really do yes, no diagnosis. And actually, as people recover, people find it harder to fit into the criteria. But I think your opinion is important. You know yourself better than everyone else.
And I think that's the thing too. I didn't walk into that office presented as the malignant, stereotypical, like abusive narcissist who has no self-awareness of anything. I already came in with years of therapy under my belt. So I think he saw that and was like, well, no, you can't. But it's because I already learned a lot of coping skills. So
yeah. So in that situation, it sounds like you were challenged with a situation where asserting yourself was probably important, but that asserting yourself could have been challenging for you.
Yeah, boundaries are still something I have to work on. It's funny because when I was at my worst with my symptoms, I lacked boundaries in the fact that I overstepped and I was cruel and I was mean. And with therapy, I've swung the other way, and now I'm too nice and I'm too much of a people pleaser. And that's still lacking boundaries, and that's still not healthy. It's just a different type of lacking boundaries.
That's so interesting because I have come across the narcissistic people pleaser. And I think that might be something interesting to touch on for the audience, because this is like, I made a video once called The Nice Guy Narcissist. And, and that's kind of, I guess, more of the covert type of narcissism. But what I've seen in people like that the people pleasing is really challenging for them, as in it's hard for them to not do it because they want to try and control the situation. But of course, as you know, there's a lot of problems with people pleasing. So I'd love your insight into how can people who are people pleasers actually have very high traits of narcissism.
I think a lot of it comes down to hypervigilance and wanting to control the perception of the situation, how someone perceives them, how they are able to navigate the outcome and able to try to make sure they have the upper hand. And it's not even intentional all the time. It's not even always malicious or vindictive. They just maybe sometimes want the person to like them. And I think that's the case with me. It's like, I don't want the person to hate me. I don't want to control them. I just want to be liked. I don't want to be perceived as a bad person or like what mean or whatever. So I people please, I overextend myself, I overcompensate, and that makes me stifle myself and suppress my voice and makes me like small, and I don't actually assert myself, and that isn't healthy for anyone to do, because over time you lose who you are because you're allowing everyone else to take space for you.
It's really interesting identity stuff, and also a good explanation of how identity can shift in terms of narcissism. It sounds like previously that your identity was perhaps in a different position where you maybe, and I'm just assuming, had less desire for people to like you, more of the I don't care what people think. So like the more kind of overt type of narcissism.
I think it was always pretty much covert. I also had BPD very severe a few years ago. And I used to like when people would call me manipulative or heartless or mean. It almost made me feel like, oh, I'm doing my job. I'm doing things right. I'm actually able to show that I can control people and that I can have power over people, because I felt like I was having no power in my life or no control in my life. And that was my way of gaining control.
So back then you didn't care so much about people liking you.
No, the only time I really cared if they liked me was if they were leaving me.
Yeah. Yeah. So then the fear of abandonment got triggered. It sounds like the people pleasing right now is a sensitivity to people's perception of you.
Oh, yeah. Yeah, I still have a lot of difficulty with that. And a lot of it is also, too, that I have strengthened my compassion and sympathy. A lot of people think that because narcissists have a deficit in emotional empathy, that they don't have compassion or sympathy, or they don't feel guilt or remorse. And that's false. They can. There's levels of it, there's a spectrum to it. And I do feel a lot of compassion and sympathy. And so I think I'm overcompensating with that, because my perception, some of it is self-serving. Like when I meet someone, I don't want them to see me as negative because I don't want to look bad upon them, and that therefore confirms my beliefs that I'm a bad person on the inside because I feel inferior. But also I just want to be a kind person, reflect kindness out into the world, because I know how I used to be. I know I used to be mean. I don't want to be that person anymore. So there's some like elements to it that some of it's self-serving, some of it's genuineness. So
Do you believe that your narcissistic traits could ever be resolved?
there are so many studies done about NPD where they say remission is possible, or they say that you can cure narcissism. And there really is no full, absolute, definitive answer. I think that I have reduced a lot of my symptoms already. Do I think I'll ever be fully cured? I don't know. But I hope that eventually I can reach a place where they're mild enough to where they don't really impact my quality of life or the people around me.
Yeah, I have met people where they were former narcissists. They are not like that anymore. And the people that I've met, what they had to go through in order to heal was extraordinary. So very extraordinary life conditions. But it gave me so much hope, because those cases are the exception. But it tells me that change is possible for anyone. And even, looking at my own life, when I was much younger, my traits of narcissism were so much higher because I was insecure. And, I think it's sometimes helpful for me to reflect on my own life and think, where was I when I was like 25 years old or something like this? I'm now 40, and my traits of narcissism have completely changed because I managed to do things that helped me feel more secure. But I would say that when I was very young, I had very high traits of narcissism, even though I wouldn't have met the criteria for NPD. But when I remind myself to look back on it, it helps me remember that, oh, wait, actually, I do understand where this comes from. I do understand why people behave in this way. And while it's not a good look in terms of some of the behaviors, that I try to tune in and remember why people behave in this way, which helps me not lose my sense of compassion for others who suffer in this way.
Yeah, a lot of people don't have the pathological disorder, but they have traits of narcissism and they can unlearn them. And if narcissist became less of a scary and bad word, people could actually look within and acknowledge their own traits. And I wish one day that could be a reality.
That would be such a fantastic world that we could potentially live in, or at least that some people could be enlightened and that we could openly speak about our own narcissistic traits as if it's actually a normal thing. Because I see people protecting their ego all of the time, just in everyday normal conversations, very compassionate people. We all end up in situations where we feel like we have to protect ourselves in that way from time to time, and just some people feel the need to do it more so than others.
Yeah, we all have an ego, and the way that we preserve it is different and it's individualistic, but we all carry traits, some more than others, but yeah.
I think that leads us to what we wanted to talk about today, which is manipulation and the common things that that narcissists do that try to control, ways that they try to control or manipulate people. So I'd love to hear a little bit of insight from you on this.
Yeah, I would like to add some insight too as far as BPD and ASPD because they're in the same cluster. HPD is also another disorder that's in the same cluster, but I don't know enough about it to talk about that. But manipulation tactics can be performed by anyone. So a lot of people assume that gaslighting and lying and cheating is like solely indicative of a narcissist, and that's not true. You can gaslight and not have any disorder at all. However, a lot of narcissists or any person with a cluster B personality disorder will fall into manipulative tactics due to the fact that their disorder is based around a struggle with interpersonal relationships and a struggle with their sense of self. So they have to find ways to adapt that. And their trauma responses usually revolve around trying to make sure they can operate in a world where they feel safe and secure and they're reassured and they're validated. And that requires manipulation.
Yeah, so that's really interesting, because what you're doing is stepping back from this, what looks like very bad behavior, and you're looking at the individual and thinking, why might they do these kind of things?
Yeah, because my partner has ASPD, which is a similar disorder to NPD, but not the same. And him and I, we have some similar traits, but the intent is very different. I look at the world through the lens of, okay, I need to feel like I have to prove myself and to feel like I am good enough. And I don't always conceptualize the emotions of other people. Whereas he looks at people as, okay, everyone is not trustworthy. Everyone is used as a resource, or I can benefit from them. And this is how his is more intentional manipulation, whereas mine is subconscious manipulation. And we utilize that in different ways, but on the outside looking in, it could look the same, but it's intentional manipulation and deceit, because that is in the diagnostic criteria: deceit, manipulation, using aliases, conning people. Whereas with MPD, that isn't in there except lack of empathy and exploiting others. And that doesn't mean consciously. I have manipulated people consciously in the past, and I think when you have a personality disorder, a lot of the traits can bleed into other disorders. So I think I did have some ASPD traits enough to where I did have a vindictive streak, and I've unlearned that since. But mine is more subconscious, because I will be doing something, just operating the world, feeling like it's normal, and then my loved ones will be like, you're thinking too much of yourself. You're not showing us that. Or yeah, it's more so that they don't feel loved or feel cared for or feel valued by me because I don't show it. I come across as cold or aloof. I'll make every argument circle back to me, or I'll just make things about me in general and not really realize that they have feelings too. So it looks like manipulation, or it looks like I don't care, when in reality, I'm just not even really thinking about the fact that they too are people who have emotions and feelings.
It's really well explained. I've sometimes seen people who are quite calculating. You can see them thinking in social situations. It's like, what am I going to do next? How do I achieve what I want to achieve? And it's like they're playing chess or something like this. And you can see there's something going on there. They're like, and they're thinking, behaving, and they're trying to get something. And then there's, I guess what you were saying in your situation is that you're sometimes just out of touch with other people's emotions because of your stuff.
One thing I found interesting about ASPD, my partner's disorder, is that he's able to think so many steps ahead. He's able to actually intentionally plan out people's reactions, what they're going to do, and he's able to mold and chameleon himself and morph himself into a person that gets what he wants, gets the resources, gets the benefits. And he doesn't do it in a vindictive way anymore. If he did, I would not be with him. But he was able to do that for a very long time and get away with it because he studies people. He looks at their micro expressions. He looks at their behavior. He analyzes everything. And there's so much just intentional manipulation there, but it's come so natural to him. Whereas with me, I'd have to really think about it. I can't chameleon and morph like that.
Do you think it has come from the same place? Do you think it was trauma, neglect, abuse, and his circumstances as well? And that it's the same things lead to these protective mechanisms in people?
Yeah, absolutely. Just different trauma responses developed from dysfunctional dynamics growing up.
What would it be like for you if you were living your life in, or even in the past, if you had been living your life in the more calculating kind of way, or did you ever have that ability to think so many steps ahead and achieve what you want? I guess was your manipulation ever more conscious than it is now?
So I've made videos about it in the past where I did do things on purpose, like purposely ignore people, purposely try to say cruel things to exploit their weaknesses and their insecurities and to make them stay. And I didn't really know what I was doing at the time, but I was trauma bonding myself to them, or they were getting trauma bonded to me. And I had like a very short-sighted view of manipulation. I think a lot of that had to do with my BPD as well, that perceived fear of abandonment, where I would like have that instability with my moods, and I would use a combination of my BPD and my NPD together. That was not a very good mix because it did include a lot of manipulation, but it wasn't calculated. I could not plan ahead. I had a thought, I did it. It's like if I wanted to break up with someone, I would do it and then would regret it like 10 minutes later and be like, oh, I'm sorry, and then unblock them and rinse and repeat. So I don't have that level of like thinking like 5 steps ahead. I can think 1 step ahead, but that's pretty much it.
So you were quite impulsive in the past.
Yeah. My BPD made me extremely impulsive. I had no impulse control whatsoever. So I was constantly blocking people and then unblocking them. Or when I was dating someone, I was breaking up with them all the time and then saying sorry 20 minutes later. And it was just this need to feel. It was almost like once I started a fight or once I said something cruel or once I blocked them, I'd feel better. It felt like I was soothing this like urge within me. And that had to do a lot with my BPD because once my BPD went into remission, I don't really do those behaviors anymore. And my NPD now is more focused on the fact that I still don't know how to conceptualize people's feelings, but I no longer have that, oh, I need to lash out, I need to block this person, I need to do whatever. Like, I don't have that anymore. I'm able to actually stop, think, and be like, you know what? We're not doing this. No. So.
Do you take time out for yourself? So if things do get a bit heated or you get triggered in your relationship, can you take some space and not communicate for a while so that you have time to check in with your emotions?
Yeah, one of the things I do struggle with still is, well, now I struggle with is withdrawing and isolating. So if I get too far in my head to where I feel like some behaviors might resurface, I will immediately shut down. And that's something that has caused issues with my loved ones because they're like, why are you shutting me out? Why are you so cold? Why do you seem so aloof and withdrawn? And it's like I almost can't access those emotions at that time when they're talking to me. And it takes me a little bit to get out of it. But I can sometimes self-soothe and distract myself and regulate myself. But other times I will shut down.
It sounds like it must be confusing at times to know which is even going to serve you best, because if there's something in your relationship where it could potentially be helpful to communicate, but then you want to shut down, or you want to, or you want to communicate too soon. It must be confusing to know, which do I do? Do I give some space, or do I, or is that going to come across as me being aloof and shutting myself away?
Yeah, I think shutting down is never really healthy for anyone because that leads to emotional suppression, and those emotions always will come out somewhere, even if it's sideways in a totally different behavior. So taking space and saying, okay, I'm going to allot myself this amount of time to just regulate and self-soothe is a lot different than just shutting down, going cold and not talking to people, or just being very short and curt and not able to open up. There's a big difference. So I'm still trying to find the balance.
Tell me about shutting down for you. What exactly is happening? So if I'm watching, if I'm looking at you in this circumstance, if I've insight, fly in the wall kind of insight, what would I see in you that would be very different to you just taking space for yourself?
So if I'm in a fight or flight state of mind, or if my emotions get triggered, or if I'm just in a very high stress environment, sometimes I'll shut down where it feels like my emotions just basically just go numb. I feel like, so it's like I need to get the words out and I can't. People will talk to me and try to express their feelings to me, and I just have like a blunted state of emotions in that moment. It's almost like a dissociative state where I can't really access it. Sometimes I will go to a place where it's hard for me to even be verbal, and I have to just sit there, regulate, like try to talk in my head, just being like, okay, let's work through this, because this is not healthy. This is not how you maintain relationships. And a lot of it's just trying to work through my own defenses, where it's trying to tell me like this person's unhealthy for you, or this situation's unhealthy, even if it is, even if they're not even the issue. It's like my brain will automatically just shift the blame onto them. And I have to learn how to navigate that, because my inner defenses are basically like trying to build this like guarded wall up, and I have to like learn how to break through that.
Sounds like your nervous system goes into overdrive in those
Yeah.
situations.
Yeah, I would say so. Yeah.
So then I imagine the level of anxiety you're feeling is just tremendous when you feel that you can't even really function in these moments.
Yeah, I would say it oscillates between, with withdrawing, I tend to not have much anxiety at all, and I'll just go into kind of a depressive state. And then the other times I will go into more of a high anxiety state, but I'll take it out on myself. I don't really have any outward behaviors towards people anymore, at least intentional ones. I'll tend to just resort to self-harm or self-destructive behaviors towards myself, which does impact the people around me, because I don't want to just say, oh, well, like that doesn't affect people. It does. When you're hurting yourself, it will affect your loved ones, because they care and they don't want to see you do those things. And I still struggle with that a lot.
Yeah. It must be hard to explain the emotional shutdown to people who don't experience that.
It is. And it's frustrating for the people around me, because I mean, I can try to explain all day after how I felt, but when you're in the moment and you're trying to resolve things, or you're trying to get your point across, or they're trying to like get their point across, there's no healthy conflict resolution there, because I'm not able to actually open up and be receptive. Or I can listen, but they're not actually getting any information from me. So it just kind of feels like they're talking to a brick wall.
What happens if the other person crosses your boundaries? So there's bad behavior, particularly in romantic relationships, because that's where often, we're most triggered and most emotionally affected. So your partner, let's just say, it doesn't have to be your current partner, but a partner does something wrong and it's just bad behavior. How do you deal with that in terms of your behavior? Do you distance yourself and, to reflect, or you communicate immediately, or, and let's just say you're being excellent in this situation, you're being fair, you're being reasonable, but it's on them.
Honestly, I try to justify it and I blame myself. I go into this mode of, well, you're a narcissist, so it has to be you. And I'll just emotionally beat myself up in my head. Sometimes I'll self-harm. And I'll just tend to go into this very internal critic mode. And I'll try to justify and give that other person every excuse in the book as to why they did what they did. And I could have just evidence in front of me as to they were wrong, but yet I will still try to excuse it away with like, oh, they're having a bad day. Oh, they had a bad childhood, whatever. I'll still excuse it away.
Wow, it must be so hard to assert your boundaries if you go straight to blaming yourself.
Yeah, that's something that like is my number one thing on my treatment plan in therapy right now, is boundaries. So yeah, that's something I still have to work on.
What's that been like for you?
It's difficult. I tend to skirt around it in therapy. I've realized that there are topics in therapy that I will open. There are topics in therapy that I will be very receptive to, and I'll just talk all day long about. But then there are other topics that I'll just skirt around or just try to like avoid. And I think it's areas where I lack self-awareness in, or it's just areas that I feel like I'm not comfortable addressing yet, but I try to avoid them when I can. But my current therapist, he's good in the fact that he doesn't let that happen. He's just like, nope, we're going to talk about it today. So it's helping me. There are quite a few situations in my life currently where I need to assert more boundaries, and I'm trying to do so.
In therapy, it's an interesting dynamic, because the therapist is allowed to ask all the questions, and it can be quite probing and quite intrusive. And understandably, there might be areas that you don't feel comfortable or ready to talk about. What's it like for you to say to your therapist, I'm sorry, but I don't want to talk about this right now, perhaps in the future?
I don't ever actually really say that out loud. I more so just kind of try to go around it, and then he'll make me dig deeper. For me, I've always masked well around professionals because I didn't want them to look at me badly. And I used to think of therapy as like a game. Not really, but like I didn't want the therapist to see me as like a negative light, because I didn't want them to see me as broken or bad or a problematic client or whatever. So I was always able to just put on the everything's fine mask and just go about my life.
Sometimes it's the therapist who's probing too much and being intrusive, and you have the right to say, actually, I don't want to go there. So I'm kind of, yeah, I think that's what you're saying is it's really hard for you to say, actually, I'm not going there directly. You skirt around it.
Even if I do skirt around it, though, I'll try to find an answer that's sufficient enough for them. It's like I almost have this little like unintentional script in my head that I've given to all my therapists, where it's like it's enough for them. But my current psych, he digs deeper, and that was something that was really eye-opening at first, because it started to make me think and do a lot of shadow work, and the script wasn't good enough for him.
Yeah, you need a really good, well, I mean, like all people, they need good people as therapists, because it doesn't really matter so much a lot of the time about the exact approach that they're using, but are they able to build relationships with people? Are they able to be real? And I think that would then, then that gives you permission to be real and to feel safe to be more direct.
Yeah, I just want to clarify my script so that people in the comments understand. It wasn't that I like wrote out this thing and have this like insidious thing in my mind. It's just that I've gained enough self-awareness over the years to understand at a basic level why I do some of the things I do. So whenever I get a new psych, they'll ask me what my history is like, and it's like, oh, I have medical trauma and I feel this and this about these situations, and usually that's sufficient enough for them. But with my current psych, it's like when I told him those things, he was like, okay, well, let's peel that back more. Why do you feel that way? And that was kind of like a breakthrough moment, where it was kind of, with narcissism, there's cognitive distortions where it's like all or nothing, and he's making me see the gray areas.
That's amazing. It's so great that he's taking the time to do that, particularly when you say you have this tendency to give him the answers that might, satisfy what he's asking, and that, he doesn't, he can see past that and knows when to dig deeper.
Mm-hmm.
What about your working life? How has your working life been since we last met?
I'm currently on disability. I do monetize some of my videos, but that's more of just pocket change. So right now I am just kind of preparing for the move across the country, and yeah.
Yeah, you're very public about your diagnosis. So people who see you on social media, or people who know you personally, they will see your social media and then you come with a label. It's difficult because people make a lot of assumptions. There's a lot of stigma that goes with it. And that sometimes when situations happen, it might be assumed that you're in the wrong and the other person must be in the right because the other person is not coming with the label. But people are human, like people are not perfect. And do you think people ever use your diagnostic label against you unfairly?
Online, yes. In person, no, except recently. When my roommate brought in the unauthorized animal, I confronted her very calmly because, like I said earlier, I don't want to upset people. I don't want to hurt their feelings. And because I think she was scared because it was unauthorized, her rebuttal was, well, you're a narcissist, so your kindness has been fake the entire time. And I have been giving her the benefit of the doubt. I have been trying to be sympathetic towards her, and she basically threw it in my face that, no, it's fake. But that was her way of trying to assert my label against me.
What was that like for you?
It was more of a slap in the face. It was like, okay, I guess if you want to assume that my kindness was fake, there's nothing I can do about it. I understand there's a stigma against narcissists. I've been the one in the household who's been standing up for her multiple times when I didn't have to do that. And I wanted to, not in a transactional way, not so that it would look good upon me, but because I did feel genuine compassion and sympathy for this person. And the fact that she thought all of that was fake due to my label, or if she was just using that as a low blow because I confronted her, I don't know. But either way, it did sting because it was not my intent to be fake. That was never what I was doing. But It's going to happen.
So that must have been really upsetting, infuriating. That must have brought up emotions for you. How did you deal with those emotions? Was it internal, or were you able to express your disappointment and your upset to this, or anger, or whatever you were feeling to this other person?
All I said was, hey, you know what? I've been in therapy for years and I understand that you have some biases or preconceptions, but I told you right out the gate when you signed the lease that I have NPD, and you said that it was okay. And that's all there was to it. I didn't want to exchange any arguments or any harsh words. I just wanted to let it go. So I did.
Yeah, that's really interesting. When this person signed the lease, you disclosed your NPD. Was that because it was public, or you just decided?
Even if it wasn't public, I still would have disclosed it, just because of the fact that the word narcissist has become so rampant in today's society and so many people have so many negative preconceptions with it. But I also didn't want her to be blindsided if she was scrolling through social media and she saw my content, or she heard me filming and she heard the word narcissist. So I wanted to be upfront and honest about it.
I can't wait till we're further along the line and we're living in a different world where there's far less stigma, and when people are explaining that they have NPD, that people won't make such big assumptions about it, because I think people go straight to, oh well, then they must be a manipulative person, and they it must be the case that they're going to do bad behaviors.
But I also do feel a lot of understanding and compassion for the people that do have those biases, because I was abused by someone who had diagnosed NPD. And if you don't have knowledge of the disorder, or if you have lived experience with someone who has hurt you and they were a narcissist, you're going to be wary, you're going to be cautious, you're going to be concerned. And so I get that, and I don't ever want to invalidate anyone's pain. So when they do express feelings like that towards me, usually it's on the internet when someone tends to write something hateful, I always try to remember they're coming from a place of pain, and I try not to take it too personally. Sometimes it's hard not to do so, but I understand there's a stigma. I understand why. It's just that there's different types of narcissism. We're not always a malignant, vindictive, malicious subtype. There's so many different other subtypes that people don't even realize there are. And we're not yet in a place in society where people know that or really understand that. It's more just a buzzword. So for now, it's just something I have to deal with, and just realize that if I'm a NPD content creator, that's what I have to deal with.
What would you advise people who ask you about when is it helpful to disclose, when might they want to disclose, and when actually is it much better to keep it private?
If you are going to have someone in your life for an extended period of time, or if you foresee yourself interacting with them, not just on a one-time basis, but a continual basis, I think it doesn't hurt to disclose. If you want to not disclose it for your own safety, and if you feel like disclosing it will put your safety in jeopardy, then don't. But if you have your symptoms managed, or if you are taking accountability for your disorder, you don't have to, because I mean, no one really ultimately is owed anything. Like, no one except your doctor is owed an explanation for the disorder that you have. So you don't have to give anyone any information about you as far as your medical history. But I felt like I should, because of the way that narcissists is handled in our society as far as the vernacular goes. And I am very upfront, open, and honest about it, because that's who I am on the internet, and I do it as a part of my healing as well. Just knowing that this is the current thing that I'm working through and trying to recover from as best I can. But ultimately, it's up to you and up to the person on whether you want to tell anyone else or not.
I want to ask about manipulation tactics in a bit more specific detail.
Yeah.
So, say for example, gaslighting. Let's just take that as one. When you've gaslighted people in the past, or when you've seen people gaslighting others, do you think people are doing that consciously, or do you think that's less conscious, or do you think it depends on the individual?
I think it depends on the individual. I know there are times in the past where I definitely did the whole, oh, I didn't say that. Oh, I meant it differently. Oh, that was not how it was interpreted wrong type of thing. And that was definitely gaslighting. I didn't know what the word was at the time, but that was absolutely gaslighting. And I'm still around a few individuals today who have narcissistic traits who definitely gaslight. And I do wonder sometimes if it is intentional or not. And I think sometimes it is. I think that it's a way to get the blame off of them. It's a way to deflect. It's a way to not have to take accountability. especially if they have a high sensitivity to criticism. People like that, they tend to not be able to actually penetrate any of the defenses that they have within them to look within. So they automatically just shove anything onto the other person.
Mm. So that's, yeah, so you're saying sometimes it could be they just need to do it and they know they're doing it, but it's protective and it's necessary. Other times, do you think there's ever gaps in their memory of how they're, because of emotions operating differently in people with narcissism, and the way we hold memories when we have certain emotions attached, we're attached to situations, we tend to remember these events better. I'm curious, do you think if there's anything to do with emotional regulation that impacts the way that events are remembered?
Yeah, absolutely. Memory is a huge thing with narcissism as far as memory loss or just convincing yourself that the lie is actually a truth. And I've done that before where I've told myself a lie so many times that I thought it was true. Or because of the fact that anyone with a personality disorder thinks in all or nothing terms, they will automatically think a distorted reality of what the current situation actually is. And therefore, whatever they're currently saying that is gaslighting, they might actually truly believe it. It may not even be a lie to them. It may be their actual truth. And therefore, it does get confusing, and it does feel disorienting when you're on the receiving end of it, because it's like, what am I actually experiencing right now? Are they right? Am I right? Are we both wrong? Like it's very difficult to sometimes understand and come to terms with.
I've seen that. I've experienced that with people where they are absolutely convinced of their reality. And I know it's not a lie because of the way they're presenting the information. It's, it's very different to someone who's just speaking and trying to persuade when they really know it's they feel it's the truth. There's like a passion and there's a conviction where you're like, no, this person is really believing their own lies.
Yeah.
What about love bombing?
I was never the love bombing type because to me, that always felt like too weak, too vulnerable. But I have been love bombed by people before. And I think that love bombing isn't always malicious. And I don't think it's always intentional. I think rarely is it intentional unless the person has ASPD, because with ASPD, like I said earlier, it is more calculating and vindictive, and my partner intentionally does love bomb people because he wants resources, and that's common in ASPD. So with NPD and BPD, I think it's more so they want to feel validated and loved and reassured, and they want their ego to be satiated, that they will project things onto another person and they'll idealize them and put them on a pedestal, and then that comes crashing down. But it's not this insidious, like, oh, I'm going to make this person love me type of way. It's that in that moment, their truth is that they believe this person is right for them and that they love them so much and that they're so great. When in reality, it's just a fictional construct in their own head.
What about trying to control others, particularly in romantic relationships? Because I think that's where people can get away with a lot of control.
So controlling in the context of romantic relationships can come from so many different reasons. It can come from abandonment issues. It can come from insecurities. It can come from a whole root of disorders, not just NPD, but really just anything that involves wanting to make sure that the other person stays regardless of how the other person feels. So they don't even think about the other person's feelings. They just think that I want this person in my life and I'll do anything I can to make sure they stay, even if it's justified with cruelty or vindictive behaviors or clinginess or like texting them a million times or just doing things that will automatically push them away. It's like a self-fulfilling prophecy.
So when you're saying that someone is controlling someone romantically, you're saying there's often a motivation of trying to keep them, not trying to drive them away.
Yes. Sometimes it's viewed as like you're an extension of me and I don't know who I am without you because you're my identity. So if you're gone, I don't know who I am. Other times it's, oh, you're a resource to me and you benefit me in certain ways. So if you leave, that resource is now depleted. Other times it's, oh, I've thrown all my self-esteem and self-worth onto you. Therefore, I need you to validate me to make sure that my ego feels satiated and feels comfortable and feels regulated. So there's all different reasons for why someone wants to be controlling. Other times it's just due to their personality, that they're a perfectionist, that they feel like they need to be in control of everything in their life because they need to have all agency of everything. And people do things for all sorts of different reasons. And ultimately, we can go all day about why people are controlling. But yeah, there's so many different things at play here.
But you're saying it's rooted in self-esteem.
Yes, ultimately self-esteem, insecurity, and the way that they were raised.
Yeah. Is there anything else that you want to share in relation to manipulation tactics that people use?
I would say that sometimes there is this performative element of weaponizing emotions. So crying conveniently, or when you're upset and then that person starts crying and you have to comfort them. It's a way to, again, not take accountability and to make sure that the person stays, because they then feel bad that they're crying even though they were the one that was in the wrong. I've done this before where if someone confronted me about something, I would start crying because I didn't want them to leave and I wanted to make sure that I still had the upper hand. So once I started crying or once I started showing this negative reaction, they would then start comforting me and being like, oh no, it's okay, I'm sorry. And then ultimately I felt like, okay, I have the upper hand again. A lot of people do that. They do it in ways of crying, or they'll do it in ways of anger. So like pretending to break up with you. And they'll do it through slamming doors, stomping around, yelling, just trying to dominate the room with their anger. And it can feel scary and it can make you feel stifled and small, but it's a way of also being controlling and making sure that they're the one in the room that has the ultimate say.
So demonstrating very strong emotions, either strong negative emotions or showing vulnerability, but it's fake and it's just an attempt to get the other person to react to the emotions that you're showing.
Also, there are times where it isn't necessarily fake. It's just that it's such a lack of emotional regulation that that's the only way they know how to demonstrate emotions. So they may not know how to show any other emotion when they're upset other than extreme anger, because that's how they were raised and they never unlearned that. Or when they're confronted with something, they'll automatically think that, okay, crying is how I need to show that I feel sorry. And they may just overdo it and overcompensate, and they may not realize how much they're putting on themselves and not actually taking into consideration the other person's feelings. So it's this weird thing of like, sometimes it's intentional, sometimes it's not. And regardless, in regards to any manipulation tactic, it's the intent. You can never know for sure what a person's intent actually is. And even they don't even know. So it's hard to decipher sometimes.
So this person might struggle to ask for their needs to be met or know what those needs are. For example, they might need a hug, but not be able to ask for it or not even think of asking for it.
Yep. And I felt that way before, where it's like when I shut down, all I really want is to feel reassured, to feel cared for, to feel like that person actually does want to be in my life, but I can't show it. It feels almost like there's like a block there where it's like I'm not allowed to actually express anything.
Yeah, because that would be a lot of vulnerability.
Mhm.
I'm wondering about you seeing ego in other people because you do this work for a living. You're really invested in knowing narcissism and understanding it. And we're all human, so we try and defend our ego. Our ego comes out from time to time. How quickly do you notice that in other people because of the work that you're doing?
I mean, I think everyone has their own ego and their own self-concept, and the disordered part of my brain, there'll always be a part of me that, depending on my state of mood, I'll either be like, oh, I'm better than them, or oh, they're so much better than me. And then there's another part of me that's like, no, we're all humans on a floating rock trying to figure out and make sense of things that we'll never make sense of. So I do have a lot of compassion and sympathy on that front. And then I'll have the disordered part of my brain that's the grandiosity and the victim complex. And so I try to find a happy medium with that and try to go towards more the healthier side of things, where I try to understand everyone operates through their ego. Just sometimes people operate in a way that is less healthy and less conducive to actual conflict resolution or actually trying to make things work in a healthy interpersonal sense.
Do you spot it in people more easily than other people because of what you know?
What do you mean by like spot an ego?
Well, let's just say you were neutral in a situation and the situation wasn't about you at all. You were just a bystander and you could see that someone's ego was coming out, like they're doing something unreasonable, something where you're like, that's their ego talking rather than them being in touch with their feelings and more in the present moment.
I can definitely understand or pick up when someone is showing an emotional reaction that probably isn't healthy to the situation, or if they're acting in a way that realistically they need some self-regulation and self-soothing in place, and they're not doing that in that moment. I can't determine whether or not someone has a personality disorder or not based off that, but I can determine if they're showing behavior that's not actually healthy or yeah, that's not actually healthy or productive to the current conversation or whatever it is that they're doing.
You've been in your relationship for quite some time now. I'm
Yeah.
curious as to what that's been like for you to navigate a relationship where the two of you have personality disorders.
It's been an interesting ride. At first, when I met him, I did not have my BPD under control. I was pretty volatile back then, and I was still doing some of the behaviors like blocking him and breaking up with him. And I did end up breaking up with him for a few months and then started doing it therapy more intensely and got back together with him. And my BPD is now in remission. I have not broken up with him or done any of those behaviors for over a year now. However, it is still difficult to manage sometimes because my primary emotions are anxiety and sadness, whereas his emotions are anger and apathy. And therefore, those clash. I am not someone who ever feels anger that much at all. If I do, it's very, very rare. So he feels it a lot. And that can be triggering to me as someone who was raised in an environment where anger was one of the first things to come out. And I have had to learn how to assert my boundaries with that and to not tolerate any sort of escalated anger or any sort of anger that raise voices or any sort of things that are not actually healthy, because anger can be healthy to a certain extent because it's usually covering up an emotion that a person is feeling. But if you're starting to escalate it with raising your voice, yelling, slamming doors, stomping around, that's not healthy. Or if you're saying things like cruelly or vindictively to try to gain a reaction out of the other person, that's also not healthy. So it's been a journey of navigating it. I had struggle a lot with, like I said, shutting down. So he has had to try to help me with showing more vulnerability because he's able to show more than I am as far as like positive vulnerability goes. That still is a struggle for me. I'm not really good with words of affirmation or good with always showing that I am affectionate and caring towards the other person. Like that just doesn't cross my mind. I have to like consciously be like, hey, this is a person I do care about and I'm not really showing that. So I kind of have to show it. So
How have you managed to navigate communicating with one another? Because I imagine this must be really challenging when both of you have a lot of stuff that you're trying to navigate individually.
I'd say that we have a pretty good balance now of learning to take space when there is any sort of disagreement and then coming back together and being like, okay, what happened? What was the trigger? Let's make sure this doesn't happen again by finding a solution to this. If we're both in a very high stress situation, our symptoms do come out more. His anger will surface to a much more his anger will surface to a much higher level than normal, whereas my anxiety will end up surfacing higher, and that can definitely clash and that can definitely cause a lot of issues. But overall, I think we have learned a pretty stable and healthy conflict resolution. But we're still working on it. No couple is perfect, and we definitely are far from perfect, and we're still trying to work things out. But I think any relationship needs to have constant evolving and growing in order to be sustainable.
So you've always been able to repair when things have gone wrong, or there's miscommunication, or there's hurt and upset.
Yeah, I mean, it's easy to throw in the towel when the going gets rough. And with this current situation, with that flea infestation and other situations going on in the household, it is difficult. And we both said to each other at one point how this was such a distressing situation that it could have broken most couples apart. And if we weren't as strong as we were, it probably would have broken us apart because it was just constant one after the other, event after event. And we both decided to work through it together instead of letting it affect us or make us like go at each other's throats.
I think this is really admirable. And I think this is where I'd love to hear your advice to the audience, because people who are working on themselves, not necessarily that they have a personality disorder, but people really struggle with their interpersonal relationships and keeping relationships together. What advice do you have for people watching about how to do that when there is some vulnerabilities with the individuals in the relationship?
So with any new relationship, it always starts out nice and pretty and all roses and the honeymoon phase, and it's great. But once you are in the relationship for a while, life happens. Things gets tough. Like external stressors will happen and you'll have to learn how to navigate it. And either you do it with the person, with the partner that's supposed to uplift you and be there for you and be your rock, or it can tear you guys apart. And it's up to you on whether you decide to actually manage it together and do it effectively, or you let that tear you down. But either way, regardless of who you're with, life happens no matter what, and you'll have to learn how to navigate that if you want to be in a healthy relationship. So that is something that you have to work on individually, learning how to be with a person and be like, hey, this is happening currently. This is currently affecting me very much, and we have to work on it together. And also the other person that you're with has to learn how to do that too. And if both of you are doing that, then that can lead to a sustainable relationship where you actually strengthen each other during those life events instead of actually making it worse.
It must be really challenging for you to do at times when you also might be carrying thoughts about, does my partner really love me? Are they purposely hurting me? Are they, are they betraying me? And these kind of negative thoughts that come when emotions are very high in relationships.
And that's where reassurance comes in. Asking for reassurance doesn't hurt as long as it's not constant and as long as you're not using that for your sole basis of regulation. You need to find distraction techniques. You need to find self-soothing techniques in order to regulate your own baseline so that you're not constantly putting it onto the other person. But also, it's healthy to ask for reassurance in a relationship. It's not, it's healthy.
Is there anything final that you want to add before we finish up today, Kylee?
I'll say that sometimes it's hard to decipher whether or not someone is being manipulative towards you, and it's hard to decipher whether you're the problem or they're the problem. But ultimately, your intuition doesn't lie. And if you're having trouble deciphering whether or not someone is toxic towards you, start making a list of any sort of situation that arises, like maybe in your notes app or on a journal where they won't look at it, and write down the date and write down what you were feeling and write down what happened. And over time, just keep this log so that you can look back on it and see evidence of the situations that have been happening, and to make sure that you're keeping yourself in check, but also that you're not excusing any behavior that they're doing. It's hard to, in the moment, realize when someone is being unhealthy towards you, but looking back on it with a clearer head can make you see things differently.
It's interesting you're saying make notes on it and that you can do that over time. When would you personally call it a day on manipulation? Because there's, you're giving this excellent advice in terms of intuition. Is it like when the person's intuition is just screaming that's the point of, exit, or what would you do in these situations?
But are you saying as far as like when to write the notes or when to leave?
Well, yeah, when to leave, because if you're writing several notes over time, there might be like 3 incidents. There might be, so I'm curious about how much notes, how many incidents before people should call it a day.
There is no set number of incidents a person has to have in order to be like, okay, I need to leave this person. But if you're asking the question, is my partner manipulating me? Are they hurting me? That is something you need to evaluate and wonder if it is an issue within you that you need to address, whether it's past trauma or certain triggers you haven't worked through, or if it's, and that's where a lot of introspection and self-reflection needs to come into place. But ultimately, if you're asking yourself that question, you should delve into the why of it, because that is not something you should be asking about your partner.
Yeah. So is my partner manipulating me a potential indicator that it might be true, but then actually, as you're saying, past trauma might be leading someone to overreact?
My relationship prior to my current partner was with someone who was highly manipulative. And when I got into my relationship, that's my current one, I thought that he probably was just going to do the same thing. And so I was being mindful of every single little thing that he did because I just assumed he was going to turn out the exact same way. And over time, I realized that was not the case. He was not operating it the same way. He was not doing things in a manipulative, intentional, vindictive way like my ex was. And so I had to work through that. That was my own baggage, my own issues, my own trauma that I had to sort through. So sometimes it's an issue of the other person, and sometimes it's an issue of resolving what you have yet to resolve.
It's pretty normal to be hypervigilant if there's attachment-related struggles. You've done remarkably well to maintain this relationship despite all of these challenges.
Thank you.
Do yourself and your partner, because I'm assuming you don't go to therapy, do you schedule regular, time where you really talk about the relationship in quite a bit of detail?
We don't schedule time as in we're going to sit down and do this, but we do both have an interest in psychology, and we also don't want to enable any bad behavior. We both are on a journey of self-improvement, and we both make mental health content about healing. So we naturally have conversations about our behaviors. And if one of us is doing something that the other person doesn't like, we'll bring it up, not in a rude way, but in a way where it's like, hey, this hurts my feelings. This isn't okay. And sometimes I will shut down. Sometimes he might get a little snippy because our disorders, we have them. Symptoms do flare up. But ultimately, we have reached a place where, for the most part, we can look at it from a healthy lens and just in that moment be like, okay, I'm sorry, I won't do that again, or I didn't realize I was doing this behavior, and we'll dial it back and we'll talk about it.
I guess that's the key, that both of you are working on yourselves. So
Yeah.
is that the advice you would give to people, is that it doesn't really matter, you know, what label this person is coming with in terms of issues, difficulties, disorders, as long as they're subscribed to self-improvement, that then potentially any relationship could work despite psychological challenges?
If someone does have a certain label, that does mean they're more predisposed to certain behaviors and therefore they should be in therapy. But ultimately, anyone can do any sort of manipulative behavior. And if they're not working on themselves, and you only can reach a ceiling with their relationship where eventually things will not be healthy because they're not working on themselves. If they're not taking accountability, if they're not admitting to their wrongdoings, if they're not actually wanting to grow and evolve as a couple and as a person just in general, then it's not going to be a healthy, sustainable relationship, regardless of the label.
Where can people find out more information about you, and where can they find you online?
So my socials everywhere is Kylee Rackham, and then on Instagram it's Kylee Rackham with an underscore at the end.
So nice to see you again, Kylee.
It was nice talking to you.
Thank you for taking the time, and I'd love to catch up with you again in the future if you're open to it.
Absolutely.
Thank you so much. Bye for now.